Hi and welcome. I'm trying to learn endocrinology, today diabetes, and after we've done it, we're going to do backstretching, and if you participate in the backstretching, there's such an on risk. And diabetes, we're talking about a disease and also some other things. Now, we already had that the human body has homeostasis that keeps the human static, what is inside of the human body, water, mineral, iron, and temperature, and also sugar content in the blood. And people who have not a good control of their sugar in their blood, or the blood sugar, they have diabetes. And normally it's the pancreas, an organ, giving out the hormone insulin, which goes through the bloodstream to the liver. And the liver then stops to doing too much glucogen, so the blood sugar into the blood. And what is too much then does it stores as glycogen in itself. And I don't understand that part here. This often causes blood sugar levels to be too high, and so glucose passes out of the body in the urine, whatever it is when passed out. And there are two types of diabetes. The first type is genetic, and where the pancreas is dumb. The pancreas is not able to produce this or enough insulin to stop the liver from producing the glucogen or the glucose, or to start the liver to convert the glucose into the glucosan. And by the second type, where the pancreas is giving out the insulin, but the cells in the body or the liver, they are deaf, and they are not hearing to the insulin that they should stop doing the blood sugar. People with type 1 diabetes need to inject themselves with insulin. It is important that they get the dose right, so they have to test the blood to see how much sugar is present. So here was written that it can be treated, type 1, by injecting insulin. So if the pancreas is not producing by type 1, then people can inject insulin, and they get insulin then from the injection. And by type 2, there was already written where the person has to make sure they don't eat too much carbohydrate. And the people need to know by type 1 how much insulin to inject. By type 1, where the pancreas is done. And so they have to test it previously. And the amount of blood sugar is depending on, by type 1, when they had a last meal and how much exercise they have done recently. So it depends certainly for the person also on a lot of other things, but now when they're measuring now, then when they had the last meal, so if they had eaten an hour or 5 or 10 hours ago, or how much exercise they have done since, or recently or since then, it would be interesting. If there's a difference between having done exercise since the last meal, or just overall, muscle soreness lasts over longer. What if the blood sugar level is over longer affected than just a few hours by an exercise, just immediately after the exercise? Glucose levels will be high following a meal and low following exercise. That is interesting. So we might gonna try to remember that for sports medicine. Glucose is high after eating. That makes sense. We're having here something written to, by type 1, the people need to control the diet carefully, and by type 2 they have to also control the carbohydrate which we eat. By type 1 is the injection. Now, why do they have to control how much, or why do the people by type 1 have more glucose after eating? Where does the glucose come from, the blood sugar? It comes from the liver, that is independent from what the pancreas is doing in insulin. So blood sugar gets higher because we eat. And normally it would be made lower through the pancreas. It should measure how much blood, through negative feedback, through homeostasis, how much blood sugar is in the blood, and then it would stop it. But the much blood sugar comes through the eating. And by type 2, they don't respond to the insulin. It still comes from the eating, That is why by both is written eating. By type 1, people also need to control the diet carefully, because it is not about what the pancreas is doing. The blood sugar level is high because the people have eaten. And by type 2, sure that the person does not eat too much carbohydrate in one meal. It's also about eating the right thing, because the high blood sugar comes from the eating. And is then controlled through the pancreas through the insulin. The high blood sugar has nothing to do with the pancreas or the blood sugar or the insulin. It has just to do with what is eaten. And then it would be made down through the pancreas and the insulin. By type 1, the pancreas is not working. By type 2, the cells are not responding to the insulin. But anyway, the blood sugar gets high when it was eaten. But this is something very important. But we have it unbelievably simple. It just gets high when it's eaten. And normally, without type 1 or type 2, it would be made down. By type 1, the pancreas is not saying make down, that is a problem, and by type 2, no one is answering to the command to make down. Okay, that is by way enough. We will continue the next part. We will do now the backstretching. If you participate in backstretching, let's say honest, if you're here for endocrinology or diabetes, you can go directly to the next part. There we will get that, talking about it. And we're starting with the backstretching. We are doing the wash. We're bringing one leg up and we're pulling the leg up. Then we're pulling the foot up. And the other leg up. And we're pulling the leg up and pulling the foot up. And to the next exercise, the trunk igniter. We're breathing in and going down slowly. And we're breathing out. Again in. Out. Again in. Out. Again in. Out. Breathing across the legs. And out. And now, I'm extending our shoulder forward apart, breathing in and lifting the arms up. And breathe out, bring the arms over to one side, go over to one side. And breathe in and out, rib cage. And breathe in and out. Again in. And out into the middle. We always breathe in through the nose and out through the mouth. Breathe again in. And out to the side. And breathe in through the nose and out the rib cage. And again out. Again in. And out over into the middle and down. We're basically not stretching through going into the position, but we're just going as far as it goes. Very easy. And when we're breathing in, that stretches. Again, the legs with one shoulder wide apart. We're breathing in. And out, we're just going down one side. As far as we can come, and then we're breathing in. And that stretches. And we're breathing out and we're bringing the arm over. So, don't pull, just over. And now breathe in and that stretches. Breathe in and out the rib cage. And again out. And again in. And out back into the middle. Breathe again in. And out, one hand slides down the leg, and the other shoulder stays down. And breathe again in. And out, you're taking one arm over. And breathe in and out the rib cage. And again out. Again in. And out back into the middle. Next exercise, the aeronautic aeroplane. The feet are standing together, we're breathing in and lifting the arms up. Then breathe out, bring one hand down. And now breathe in and reach. And out. Again in. And out, one hand down. Breathe in and reach. Next, arm shoulder wide apart, breathing in, lifting the arms up. And breathe out, we're leaning back, up the chest to the sky. Breathe in, up across your arms, intertwine the fingers, reach high. Breathe out and reach front, the macro. Breathe in the arms up. And out again down, and up chest to the sky. Breathe in, up across the arms, intertwine the fingers, reach high, breathe in. And out, reach in front, hollow the back. Again, in the arms up. And out and down, intertwine the fingers behind the back. And lean in front with a strong core. If this exercise is too much, then don't do it. Strong core, and we're bringing the arms up. Still strong core, and bring the arms up. And straighten up with a straight back, strong core. Bring the arms again down. And we're doing backward shoulder circles at the end. One. And the second one. And the third one. That was a back stretching. Thank you very much, and until next time.